Yeah, we are live now. Let's wait for a few people to join and then we can start.
Sure.
Guys, if you people have joined, please send a hi so we know. I see some people joining in. Do send a hi in the comments. Yeah, people have started to join in. Good morning, everyone. On International Families Day today, I'm here to bring forward a very relevant discussion on women's health after the age of 30. We will also talk about reversing the reproductive age and busting common myths. We often see a lot of queries and concerns around infertility. It is believed that women cannot conceive or have significant difficulty conceiving after they turn 35. However, that in fact is untrue. It can be easy to conceive after age 35 with a healthy diet, balanced lifestyle, and a trusted professional who can help you discover all treatment options. So today joining us will be Dr. Mahesh Raman from Sepalika Fertility, which is a fully online holistic female hormone health clinic to discuss all about women's health and share with you some eye-opening facts. Welcome, doctor. Good morning.
Good morning, Kanupriya. Thank you so much for giving us this platform to answer questions, to tell people what we have discovered about natural women's health.
Yeah, first and foremost, I would like to ask you that it is commonly believed that one should have their first child before they turn 30, or else it gets difficult. So, what do you have to say about it from your experience?
Yeah, so honestly, of course, it would be good to have your first child before you're 30. And the reason for that is obviously the younger you are, the easier it is to conceive and the better chances because it's just common sense, right? So we shouldn't, many times I think we get confused with medical facts and things like that. So it's just simple common sense. You've been having periods, let's say, since the age of 13 or 14. Remember, as far as nature is concerned, every single period is a missed baby, right? You could have had a baby in that period. Now obviously we only want to consider that after you're an adult, at least 21, after you're settled in life, etc., so that it's not just about biologically bringing a baby into this world but also being able to take care of that baby. So certainly from the age of 24, 25, there is a very good window when you should, ideally, if all other life circumstances permit, you should have a child. However, these days it's obviously husband and wife are both working. There are so many sort of career desires on both ends, and people want to be settled before they start. So most women who come to us are often in their mid to late 30s, who have sort of had to wait. They've built careers, they've probably built homes, and now they're ready to start a family. What is important to realize is it isn't that biological age or that number that matters. What matters is how healthy are you at that 32, 30, 33, 35, even
Yeah.
36. What is your health like? You can be a 30-year-old who has the health of a 35-year-old, or you can be a 35-year-old who has the health of a 28-year-old. So that is what really matters. And getting your nutrition, your diet, your lifestyle, your supplements in place can make you young enough to have a baby even in your 30s.
Actually, that's a very interesting thing that you said, that it's not about the age but about how an individual's health is at that point of time, right? So
Yeah.
that's quite an interesting fact. So what role does food play in increasing the chances of fertility?
So again, huge role. And again, I would say don't just look to doctors for these things. Use your common sense, right? So it's like saying, what role would food play in my thyroid health? Of course, it would play a
Yeah,
great role. How would
that would
food
be the
affect my
question.
hair health, right? So similarly, so remember, in all natural medicine, Ayurveda, and even Western science accepts this. The sperm and the egg, which is the reproductive tissue from which babies are formed, is the final or the most advanced purification of all the food that you eat. In Ayurveda, we say there are literally 7 stages of purification of the food that you eat before it finally becomes a sperm or an egg. This is called the Sapta Dhatu, or the seven dhatus or tissues, right? So They say कि you put food into your mouth, it becomes something called rasa, literally like the slurry stuff that we swallow. That rasa becomes rakta or blood. That rakta becomes mamsa or flesh. That mamsa becomes medha or fat. That medha then becomes asti or bone. And that asti becomes asti majja or bone marrow. And finally, that asti majja becomes shukra. So the bone marrow finally turns into sperm or into ova. So if you're putting in bad raw material at the start, you can imagine what's going to happen at the end. And similarly, you can influence the health of that egg and that sperm by eating healthily. So the right balance. So the first thing we tell everybody is, here's a simple tip, right? So everybody, nobody is here on a Sunday just to hear about knowledge. They want practical tips. So here's a simple practical tip. Take a simple plate that's 360 degrees round, standard Indian thali. Divide it into four parts, just four quadrants. One first quarter should be raw or uncooked vegetables. The second one should be cooked vegetables. The third one should be whatever protein source. If you're non-veg, it can be chicken, mutton, anything that you want. If you're veg, it can be paneer, dal, moat, anything that's your source of protein. And only the last quarter should be your roti or your rice. Unfortunately, in India, usually at least half of the plate is roti or rice, right? And then everything else gets crowded into that little thing. Sometimes there's salad, sometimes there isn't salad, and so on. So the important thing is, if you balance your plate like this with the right balance of proteins, carbs, and fats, you've already laid the foundation for your own great health and to create really healthy babies. So start from there. Food does make a huge difference to the kind of babies you'll have and to your fertility.
Yeah, sure. And obviously, we know that thyroid plays a very important role in fertility and in all sorts of body functioning. Can you like tell us how can we balance our thyroid levels naturally? I mean, we know that obviously medication helps, but what else can a thyroid patient do to balance their levels?
Sure. So, one of the big things to realize about thyroid is it's a master gland in the body that decides what's going to be your rate of metabolism or energy spending, right? So, if everything else is fine and yet you are stressed and if you're not sleeping right, your body uses the thyroid hormone to slow down your metabolism. It literally turns it down. कि आपका लाइफ तो चलता रहेगा बट इट विल नॉट बी सच दैट यू कैन प्रोड्यूस अ न्यू लाइफ. सो मेनी कपल्स हु कम टू अस दे से कि हमारा थायराइड नॉर्मल है. So when you see the lab reports, there also it seems TSH is normal, T3 is normal, but there is a difference between low normal and high or optimal normal. Even
Yeah.
there is a range. तो अगर आपको नया लाइफ क्रिएट करना है, you're trying to create a new life, that's a very energy intensive process. उसके लिए लो ऑप्टिमल से नहीं चलेगा, आपको हाई ऑप्टिमल की जरूरत
Yeah.
है. And that means sleep is crucial. जहां आपकी नींद उड़ी, the point at which you start getting disturbed sleep, आपको 6 घंटे आ रहे हैं, हल्की नींद आ रही है, रात को 2 बजे आप उठ जा रहे हो, if these things are happening to you, there is a good chance that your thyroid will be impacted. So fix your
Okay.
sleep habits. Go off your phone at least 1 hour before sleep time. Make sure that you do simple dadi ma ke nuske, wash your feet before getting into the room. Make sure the room is adequately cool. It's dark enough. There aren't lights that are coming through all the time. And don't sleep too close to dinner. Dinner or sleep ke beech mein try and creep at least a 2.5, 3 hour gap. If you
Yeah.
do these things, funnily enough, just that improved sleep improves your thyroid function. So
Okay.
that's one crucial thing to do. नींद को ठीक कीजिए, thyroid ठीक हो जाएगा. The second thing we tell all our women is there's a simple home nuska which is called seed cycling. So many of you may have seen this online, but here's again a second practical tip how to do it. Period is 30 days, right? Normally, just andaz say sometimes it's 28, sometimes it's 32, 35, whatever it is, divide that into half. In the first half of that period, meaning from the time you start bleeding till about 15 days or so, take 1 tablespoon each of two seeds. Remember the acronym FLAP, FLAP, flax seeds and pumpkin seeds. So 1 tablespoon of flaxseed, 1 tablespoon of pumpkin seeds. पिछली रात को भिगो दीजिए उसको. Get up in the morning and have those seeds. You can throw away the water, just have the seeds. This is the first half of your period cycle. Second half of your period cycle, remember the acronym SUSE, SUSE. sunflower seeds, sesame seeds. आप उसको भी same 1 tablespoon each, just soak it previous night, throw away the water, eat it. Just doing this seed cycling, 15 days of two and 15 days of the other two, will help to restore all your hormones in your body, estrogen, progesterone, thyroid as well. तो आपकी जब hormones balance में आ जाएगी तो automatically everything will work well. So irrespective whether you have painful periods, whether you have polyps, whether you have irregular periods, you just follow this, and usually within 3 or 4 cycles you will see what a big difference it can make.
Wow.
That's because ye jo seeds hai, the first two seeds I mentioned support the hormone estrogen, that is the flax seeds and the pumpkin seeds, and jo second seeds hai jo sunflower or sesame hai, they support the hormone progesterone. So naturally in your body these are the two hormones working
Yeah.
in the two halves of the period. अगर आपने इन दोनों को ठीक कर दिया तो थायराइड भी अपने आप ठीक हो जाएगा. So try these. Very simple, does no harm. You can do it at
Yeah.
home.
So you said one tablespoon each, right?
That's right.
Yeah. So I know like sleep and whatever stress and these things are really impactful where thyroid is concerned. But I think that's like the most difficult to achieve for many people.
Yeah, and I
Yeah.
often say, don't go for all or nothing. ऐसा नहीं है कि भाई बड़ी आपकी कच्ची नींद है, 4 घंटे सो रहे हो, next day you have to be a sleep champion and wake up for 8 hours. I mean, sleep for 8 hours like a
Yeah.
log. ऐसा नहीं होता. But every half an hour, even if you can give your body that rest. Remember, जब आप
Yeah.
सो रहे होते हो, तो your body is in rest and digest mode. That's when it's repairing itself. So if you give your body even half an hour more of sleep, it's going to do its jobs that much better.
Yeah. Yeah. Okay, moving on. So, how to sustain a precious pregnancy that is achieved after the age of 35? I know some people actually who conceived after 35. So, what is the best way for that?
Yeah, so this is, so at Sepalika, like you said at the start, we run it as a female hormone health clinic. So one of the crucial programs that we run for people is a pregnancy management program. And for us,
Okay.
in that pregnancy management program, because hamari sari pregnancy is precious hoti hai. Obviously, nobody will come to us unless they're
Yeah.
having trouble conceiving naturally, right? And usme bhi we get those cases who have already failed with IUI, IVF, etc. Right? It's only those who have lost all hope that will usually come to us. So that will be a 35 plus age ka profile. And first
Yeah.
we work with them on our fertility program, and we fix their diet and we fix their vitamins, minerals, we fix all the things nobody else has fixed, and we get them pregnant. Once they've gotten pregnant, now we say this is a precious pregnancy. It's happened after 35, so risks are greater that you could not carry it to term. It's possible many, इसीलिए बताते नहीं है इंडिया में. पहले 3 महीने तक हम सिर्फ एकदम जो क्लोज घर वाले हैं उनको ही बताते हैं. That's because it
Okay.
is well known to us also कि first 3 months में you can lose that baby because the placenta is not fully
Yeah.
formed. It's a precious pregnancy achieved at a certain age. So therefore, protecting it at that time needs sufficient amount of a hormone called progesterone.
Yeah.
Progesterone name itself means that which protects gestation. Pro-gestation, progesterone. इसका मतलब ही यही है कि it protects the pregnancy. And many times what happens in India is gynecologists aren't regularly testing for progesterone levels during pregnancy. वो
Yeah.
मान के चलते हैं कि अपने आप वो बढ़ रहा है. But many times that does not happen. And so it is important to supplement a slightly older lady with progesterone and make sure that the pregnancy is protected. There are several other things that we do as part of the pregnancy program. So see, there is wisdom in the West and there is wisdom in the East. It is foolish to not do one and the other, right? So हम दोनों, आप मुंबई में
Yeah.
बैठे हो, मैं दिल्ली में बैठा हूँ, we are running ACs, तो ऐसा नहीं है हम पेड़ की छांव में बैठे हैं. So it's not
Yeah.
like you should not use modern technology, but at the
Yeah.
same time, by using Ayurvedic mantras during pregnancy, we've seen such a big impact on the baby and the mother. Many times,
Yeah.
problems like gestational diabetes can be avoided if you have guided the mother on traditional principles during the pregnancy. जो डायबिटीज मदर्स को ड्यूरिंग प्रेगनेंसी आ जाती है या थायराइड की प्रॉब्लम ड्यूरिंग प्रेगनेंसी आ जाती है, if you
Yeah.
know how to prevent it, many of our
Yeah.
customs have little things that help you to do that. So those are the things to do during pregnancy. So I would suggest every pregnant lady on the Sepalika program on a monthly basis does a blood test for serum progesterone during the 9 months 10 months of gestation. So we are always tracking that. बहुत सस्ती टेस्ट है, 250 रुपए में होती है. I don't know why more gynacs don't do it. It's $250. They'll come home. India में तो आपको कहीं जाना भी नहीं पड़ता. The blood guy, comes home, the lab guy. So just do that test and be sure that your progesterone levels are adequate. That is how you protect a precious pregnancy.
Yeah. So actually, it makes sense, to use a good combination of, like you said, modern technology along with, Indian Ayurveda. So that is good. Yeah, and also what I realized was that even I got gestational diabetes and thyroid during pregnancy. So, I mean, I wish we knew, how to not get it at that time, because
जी,
that would
जी.
be really a game changer,
And
I
this is,
think.
important, Kanupriya. I'd just like to spend one more minute on the thyroid part, जो आपने पूछा. What many people don't realize is the child is even up to 26, 28th week, only the size of a banana. हम सोचते हैं ना बच्चा कितना बड़ा है, हमें अंदाज नहीं होता है. The child is hardly the size of a small banana. सबसे पहली गलती होती है इंडिया में नहीं, वर्ल्ड वाइड. एवरीबडी सेज अब तुम प्रेग्नेंट हो, यू हैव टू ईट फॉर टू. तुम्हें दो के लिए
Yeah,
खाना है. आपने दो के
yeah,
लिए नहीं खाना है. यू आर ईटिंग फॉर
yeah,
वन अडल्ट एंड वन बनाना साइज्ड ह्यूमन बीइंग. So
yeah, yeah,
don't go crazy on the calories. It's
yeah,
what that proverb is meant to be, is that you must eat very nutritious food, not in
yeah,
quantity. आपको ऐसी चीजें खानी है जिसमें बहुत सारी न्यूट्रिशन हो, because you're eating
yeah.
for two. So if you follow that principle, generally gestational diabetes can be avoided. And the second thing most people don't know is that small human being who's growing inside you doesn't have a thyroid gland till the
Okay,
almost the end of the second trimester. So
okay,
first two trimesters, the baby is relying on the mother's thyroid gland to produce thyroid hormone for mother and child both. तो इस वजह
okay,
से मेनी लेडीज हु एंटर इनटू प्रेगनेंसी, जैसे मैंने कहा, थोड़ी सी लो नॉर्मल में, मतलब इट्स नॉट फ्रैंक हाइपोथायरॉयड येट, बट आप लोअर लेवल ऑफ नॉर्मल पे हो. When you enter into pregnancy like that and the baby starts drawing down on your thyroid as well, you
okay,
automatically fall below that threshold and you become hypothyroid. तो अगर किसी ने
okay.
आपको पहले से ही मैनेज किया होता एंड लो में से आपको ऑप्टिमल पे ले जाते, तो even after the baby's needs are met, you will have thyroid for yourself. Otherwise, हमारे क्लिनिक में
Yeah,
इतना हम सुनते हैं, my thyroid started after my first delivery. मेरा पहला बेबी के बाद मेरा डायबिटीज शुरू हुआ. So these things are happening because you are
yeah,
entering into pregnancy without optimal nutrition. आप
yeah,
उस एज में ही पहले से तैयार होके अगर चले जाओगे, तो automatically you will not get drawn down to the level where you become frankly deficient.
yeah, yeah. Because even my one doctor told the same thing, that TSH should be one if you want to conceive a child. And I was like, one, it's impossible for me to achieve that. So
Yeah.
yeah, that's
Yeah,
true.
but optimal thyroid होगा तो अपने आप TSH1 आ जाता है. He
Yeah,
or she was absolutely right.
yeah. So one common myth is that painful periods are a part of life, and I know from my personal experience that it is something which is not true. So according to you, what are the signs that women should watch out for? That says that no, it's not normal.
Absolutely. And excellent question, because this starts from puberty itself. ये भी नहीं है कि later age में आके होता है. कि अगर 13-14 साल की बच्ची भी है जो स्कूल जाते जाते she's gets her period etc. साल में अगर एक दो बार आपको हल्का पेन हुआ, right, you're in some discomfort, abdominal cramping, some amount of moods, feeling a little low, साल में मतलब 12 periods में से एक दो में अगर होता है, तो it is not unnatural, because many times there could have been an event before that. या तो आपको वायरल
Yeah,
हुआ या कुछ हुआ और उसके बाद पीरियड आया, या आप एक्सकर्शन पे गए, ट्रैक पे गए, कुछ आपने बहुत फिजिकल एक्सर्शन किया, घर में शादी थी, फॉर मे बी अ वीक और सो एवरीबडी वाज रनिंग अराउंड. ऐसे में अगर आपको थोड़ी बहुत डिस्कम्फर्ट आती है, तो वी कैन एक्सेप्ट दैट एज नॉर्मल. अदरवाइज, इन होलिस्टिक मेडिसिन, इन ऑल्टरनेट मेडिसिन, वी से लिटरली पीरियड शुड क्रीप ऑन यू. मतलब आपको पता ही नहीं होना चाहिए कि हाय आज पीरियड आने वाला था. It should be that
okay,
symptom free. There should be no moods, there should
yeah,
be no bloating, there should be no cramping, no water retention, no digestive distress, no pimples, no acne. That's why am I saying that? It's because women have this wonderful thing called a period, which is like a report card of health every month.
yeah,
अगर आपकी सारी डाइजेशन, एलिमिनेशन, लिवर, लार्ज इंटेस्टाइन सब अच्छे से अगर चल रही हैं, तो देन द बॉडी शुड बी एबल टू use the hormones needed to create a period and yet break it down and remove it without any trouble. अक्सर जो प्री मेंस्ट्रुअल सिंड्रोम कहते हैं, पीएमएस
Yeah.
जो कहते हैं, that comes because the body is trying to remove excess of estrogen from your body, क्योंकि estrogen का काम खत्म हो चुका, अभी पीरियड आना है, बट
Okay.
क्योंकि आपकी लिवर पहले से ही इतनी बर्डन है, आपने जंक फूड खाया, आप सोए नहीं, आपकी लार्ज इंटेस्टाइन ठीक से चल नहीं रही है, सो नाउ द वेस्ट दैट द बॉडी हैज टू रिमूव, इट इज अनेबल टू डू इट एफिशिएंटली. So
Yeah.
then you feel all these horrible symptoms, as if you've swallowed something huge, bloated feel करते हो आप,
Yeah.
moods आपकी आ जाती हैं, water retention होता है, acne की जो breakouts होती हैं, that is often too much estrogen which cannot be, which the body is struggling to eliminate through your natural excretory process. वहां से निकल नहीं पा रहा है तो skin पे वो breakout होके आ रहा है. So you should be
Yeah.
aware that ideally you should get your periods 10 times out of 12 in a year without any symptoms. And if you are getting any of these symptoms that I mentioned, it's time to examine your lifestyle a little and see कि कहीं आप इनमें से कोई चीज तो नहीं कर रहे कि you're taking too much stress, you're not sleeping well, you're eating junk food, any of those things. And if you reduce them, आपको अपने आप दिखेगा next period में, it will be far smoother.
Yeah, I would like to share my personal experience here for the benefit of everyone. So, what really happened with me was I used to have painful chums every month. But one time, what really happened was it was painful, no doubt, but it was a very different kind of pain. So, I realized that this is not normal. So, which is why I asked that question, because I realized that okay, I have pain every month, but this is not what the pain is like. This is different. So, and that was the first time the lockdown happened, okay, in 2020, and everything was shut. We were not allowed to even move out of homes.
Mhm.
So obviously I was stuck up, but I was like, this is not normal, and it was going on till 7 8 days actually, the pain. So which is when I just talked to one physician, whoever I could get hands off, on call, that this is what is happening. He was a male. So he said, since you are a female, just get this one test done. So in that time I just got my test done, and it turned out that I had a very large fibroid. So what I'm trying to tell here is that to everybody, that if you see something unusual, and like a lot of people over there told me, like my family and everyone told me, just chums ka pain, ye to hota hi hai, it's nothing. So don't listen to it. You know your body better, and just get yourself tested. It could be anything,
So one,
right?
thank you so much for sharing that, Kanupriya. And I think it's very important for everybody to be body aware, right? अपने body को हम खुद से ज़्यादा nobody knows, and therefore
Yeah.
being aware is excellent. But one more minor point I'd make, not to sort of say something after an event has happened, but आपकी जो पहले की periods, जो chums में आपको pains आते थे, अगर हम उसे भी normal नहीं मानते, तो fibroid नहीं बनता. Okay, this is important to
Yeah.
realize. The important thing is a fibroid doesn't grow overnight. Fibroid
Yeah.
grows because of estrogen excess over years, and somewhere or the other, because we have all been trained to think कि कुछ पेन तो नॉर्मल है, ये मेरी
Yeah.
नॉर्मल पीरियड पेन है, ये मेरी एबनॉर्मल पीरियड पेन है. नहीं, कोई नॉर्मल पीरियड पेन होता ही नहीं है. और जितने
Okay.
बार आप उसे नॉर्मल समझोगे, थोड़ा थोड़ा करके, दैट whatever is that imbalance is actually growing. And agar fir, then one day it will reach a stage where you will need an intervention. And again, my thing is
Correct.
not कि आप पेन होते ही आ जाओ सिपालिका के पास, हम आपको ठीक कर देंगे, वो नहीं करना है. The minute you start feeling that pain, अगर आप सीड साइकिलिंग सिर्फ भी स्टार्ट कर दोगे, अगर आपने सिर्फ फ्लैप और सूजी को याद रखा और आपने वो स्टार्ट कर दिया, तो यू विल फाइंड इन 2 or 3 periods that so called normal period pain will also not be there. That is the
Yeah.
important message to take away, because हम अक्सर, हमारे पास जब तक केस आता है बिगड़ा बिगड़ा हुआ होता है, क्योंकि फाइब्रॉइड
Yeah.
एक मिनिमम साइज हो जाता है, उसके बाद सिर्फ ऑपरेशन हो सकता है और कुछ हो ही नहीं सकता उसके साथ, और they'll tell you wait for menopause. It's one or the other. So it is possible for us to be little bit more proactive. I'm not saying कि बात बात पे आप घर को सर पे उठा लो. I'm only saying these are little
Yeah.
नुस्खे जो आप खुद ही कर सकते हो without having to tell anybody, and yet you must know that pains are not normal. So that's the takeaway message.
Yeah, that's great. Actually, there is always a reason for pain
Ji,
or for any other problem. Correct. Okay. So, a lot of people have questions. Should we take some questions?
please.
Yeah. So somebody is asking, which is relevant to our topic also, that how does a woman know that she is nearing menopause?
Okay. So
Are there
the
any signs?
Sure. So the medical definition of menopause is that you shouldn't full menopause is that आपको 12 महीने continuous तक कोई period नहीं आनी चाहिए.
Okay.
Approaching menopause is a technical term given called perimenopause. That means you are in the perimeter of menopause. तो how will you know? You will know अगर आपकी पहले regular periods थी और अभी 2-3 महीने बाद आ रही है and you are in that particular age bracket. Sometimes early menopause also happens, but let's say we are talking about a average person and then it means 45 के एज के बाद अगर आपको periods 2-3 महीने में एक बारी आते हैं या कभी कभी 2 बारी एक महीने के अंदर आ जाते हैं, these are all signs that you might be perimenopausal. पेरीमेनोपॉजल में एक और इशू आती है विच इज वेट गेन अराउंड द हिप्स. अगर आपकी नॉर्मल से ज्यादा वेट गेन हो रही है अराउंड द हिप्स, तो इट कुड ऑल्सो बी अ साइन दैट यू आर गोइंग टूवर्ड्स पेरीमेनोपॉज बिकॉज हॉर्मोन्स हैव अ रोल टू प्ले इन वेट मैनेजमेंट. Third
Yeah.
sign that I would, which is very common, which I would say you should look out for, is intolerance to heat or cold. आप एक कमरे में बैठे हो, चार लोग हैं, everybody else is feeling comfortable, and suddenly you break into a sweat. आपको ऐसा लग रहा है जैसे पूरी गर्मी 1 मिनट में आई. You kind of feel the sweat trickling down your back. This is called a hot flush, and this hot flush could also be a sign of perimenopause. Whenever any of this happens, it would be advisable to see a professional and get some blood tests done, which can tell for sure are you heading towards perimenopause.
Okay, sure. Thanks. One more question is that what is the, like, if there's swelling in ankle, especially at night time, does it indicate anything?
Yeah, you should get your thyroid examined अगर ankles की swelling है specifically, because कई बारी क्या होता है and it happens only at night time. So it could be one of two things. One is there could be some kidney function that is a little compromised. So you should again do a simple KFT, kidney function test, blood test होती है जिसमें पता चल जाता है how efficiently are your kidneys working. कहीं water की जो body में requirement है उससे ज़्यादा तो शरीर रोक नहीं रहा पानी. That's one thing. But generally, ankle swelling is often to do with a low functioning or hypothyroid. Don't go by only TSH. TSH is meant to be a general indicator. Doctors are trained to both look at TSH and also ignore TSH and see the patient specifically. तो अगर आपको ankle में swelling आ रही है तो do get your thyroid test done. It is possible that there could be mild thyroid and many times that can be naturally reversed without requiring thyroid medicine अगर early पकड़ते हैं.
Yeah. So somebody is asking about thyroid antibodies. Is that reversible? I don't know. Like,
Yeah, so thyroid antibodies, let me tell for the remaining people who may not know what it is. Thyroid दो प्रकार की होती है. एक तो वो थायराइड होता है जिसमें आयोडीन बॉडी में कम है. इट्स कॉल्ड आयोडीन डेफिशिएंसी हाइपोथायराइड. उसमें आयोडीन देना होता है और आजकल हम सब आयोडाइज्ड नमक खाते हैं, तो इस वजह से जो आयोडीन डेफिशिएंसी हाइपोथायराइड है वो काफी कम हो गया है. The second kind of thyroid, which is very common these days, is the one that the lady is asking about, which is called autoimmune thyroiditis.
yeah,
डॉक्टर हाशिमोतो के नाम से एक डॉक्टर थे, जापानीज थे, उन्होंने इसे डिस्कवर किया था. तो इट इज ऑल्सो कॉल्ड हाशिमोतोस थायराइडाइटिस.
yeah,
इसमें क्या होता है, शरीर अपने ही थायराइड ग्लैंड को अटैक कर रहा होता है. सो देर आर एंटीबॉडीज अगेंस्ट द थायराइड ग्लैंड. तो इसको पूरी तरह से रिवर्स तो नहीं किया जा सकता, अभी तक मेडिकल साइंस में वो नहीं है. बट वी हैव सीन विथ नेचुरल ट्रीटमेंट द रिडक्शन ऑफ द लोड ऑफ एंटीबॉडीज. तो अगर आप स्टार्ट करते हो और आपकी एंटीबॉडीज 200 की लेवल पे है, अगर आपने डाइट को ठीक किया, अगर आपने नींद को ठीक किया, इन्फ्लेमेशन को ठीक किया, तो इट विल कम डाउन टू 50 और 60 एंड यू विल सी द इम्प्रूवमेंट्स इन योर ओन सिम्टम्स एज वेल. अगर आपको हेयर फॉल बहुत भयंकर हो रहा था या आपको नींद की प्रॉब्लम आ रही थी या एनर्जी की प्रॉब्लम आ रही थी, all those things can get better. So we are not allowed to technically claim reversal of Hashimoto's because it is not proven, but you can manage it very efficiently and have better thyroid health.
yeah. So you mentioned about iodized salt. So a thyroid patient should have iodized salt or no? What is
Yeah.
recommended?
Yeah, so thyroid patient का आयोडाइज सॉल्ट से कोई लेना देना नहीं है. इन जनरल
अच्छा.
दिस इज व्हाट वी टेल पीपल.
Okay.
वी टेल देम आप सेंधा नमक हफ्ते में 5 दिन यू यूज रॉक सॉल्ट और सेंधा नमक, ओके,
Okay.
एंड 2 days of the week you use iodized salt. Why do we say this? It's because the sendha namak misses doesn't have only one mineral, which is iodine.
Okay.
Okay, whereas the iodized salt is missing all the other minerals except iodine.
Okay.
एक फैक्ट्री में बनती है जो आयोडाइज सॉल्ट होती है, उसमें सिर्फ आयोडीन डालते हैं वो, और कुछ नहीं होता. देयर इज ओनली सोडियम क्लोराइड एंड आयोडीन इन दैट, कोई तीसरा मिनरल नहीं है. लेकिन जो नेचुरल सी सॉल्ट है उसके अंदर मैंगनीज, मैग्नीशियम, सोडियम, पोटेशियम, हर प्रकार की मिनरल होती है. तो वी टेल
Okay.
पीपल गेट द बेस्ट ऑफ बोथ वर्ल्ड्स. 5 दिन
हाँ.
घर में एक नमक यूज करो, 2 दिन घर में दूसरा नमक यूज करो. इफ यू कैन टर्न इट इनटू, बिकॉज वी ट्राई टू, हैबिट चेंज इज नॉट इजी टू डू. तो आपको याद रखना पड़ेगा कि वीकेंड है तो हम आयोडाइज सॉल्ट यूज कर रहे हैं,
हाँ.
वीकडे है तो
That's
हम,
it.
so that's one way of balancing both. But for
Yeah.
thyroid patients also the same rule applies, 5:2.
Yeah, I mean that's really helpful. Okay, so one question was that this is actually a very relevant question. I also think that why is sugar test done during pregnancy? Okay, this we understand why it's done, but why is sugar given to drink in liquid form for the sugar test when they say not to drink juices or not to intake sugar?
Hanji.
So what's the
So,
logic?
yeah, this is called an OGTT, an oral glucose tolerance test, literally. हाँ, तो आपको 75 ml दिया जाता है, एकदम मीठा
Yeah,
सा ग्लूकोज रसना की तरह आपको जबरदस्ती पीना पड़ता है. एक तो
yeah,
आधी उल्टियां तो उसी में आ जाती हैं, बट you have to gulp it down. So the idea is they are trying to give so much sugar to your body to see how your body reacts to sugar.
to the
सो
sugar.
इट्स अ
Yeah,
वेरी लिमिटेड एक्सपेरिमेंटल थिंग. मतलब ये नहीं कि रोज थोड़ी ना आपको वो जूस पीने के लिए कहते हैं. तो दैट
yeah,
इज नॉट ट्रू. सो व्हाट दे आर ट्राइंग टू सी इज हाउ बैड इज योर बॉडी रिएक्टिंग टू शुगर. देन दे कैन गिव यू एडवाइस अकॉर्डिंग टू दैट. तो आपने 75 ml पिया, उसके बाद आपकी फर्स्ट ब्लड टेस्ट 1 घंटे बाद लेते हैं, पीपी शुगर 1 आवर लेटर. देन दे टेक पीपी शुगर 2 आवर्स लेटर. तो पता चल जाता है जैसे ही चीनी हमारे पेट में
yeah,
गया, हाउ मच आवर इंसुलिन स्पाइक एंड हाउ लॉन्ग डज द हार्मोन इंसुलिन स्टे हाई. अगर वो 1 घंटे बाद भी शुगर आपकी लेवल हाई है, दैट मीन्स यू ऑलरेडी हैव रेजिस्टेंस टू शुगर, यू हैव रेजिस्टेंस टू इंसुलिन. दैट मीन्स आपकी
okay,
चांस ऑफ गेस्टेशनल डायबिटीज इज हाई, एंड आइदर द डॉक्टर शुड गिव यू प्रॉपर डाइटरी एडवाइस और दे विल स्टार्ट यू ऑन अ मेडिसिन कॉल्ड मेटफॉर्मिन. सो इट्स वन
yeah,
और द अदर. तो इस चीज को देखने के लिए ये टेस्ट होता है, नॉट sort of as on a regular basis.
yeah, sure, sure. Okay, okay, let's move on to PCOD. What are the symptoms that we need to watch out for PCOD, and how can we reverse it?
Sure. So PCOD, again, very very common problem these days. We see it in young people. We see it in people in their late 20s, 30s also. So the idea is the following: कि जो ovaries होती हैं उनमें every month one follicle or one egg is supposed to develop, and that is the egg that presents the possibility that the lady could fall pregnant in that period. In people with PCOD, problem ये होती है, rather than one follicle develop, many follicles try to develop at the same time. तो जब आप इसको अल्ट्रासाउंड में देखते हो, आपको पॉलीसिस्ट्स या मल्टीपल सिस्ट दिखती हैं ओवरी में. सो इट्स बेसिकली ऑल ऑफ दो सिस्ट्स आर नथिंग बट फॉलिकल्स ऑल ट्राइंग टू मैच्योर. रादर देन वन ऑफ देम मैच्योरिंग, मेनी ऑफ देम आर ट्राइंग टू मैच्योर. तो इसमें एक पर्ल नेकलेस टाइप की अपीयरेंस आती है, जिसको अल्ट्रासाउंड में बड़ा टिपिकल पॉलिसिस्टिक पर्ल नेकलेस करके वो रिपोर्ट में लिखते हैं. तो पॉलिसिस्टिक ओवरी डिजीज इज अ डिजीज वेयर यू विल हैव जनरली इंसुलिन रेजिस्टेंस. अगर आपने शुरू में इसे रिवर्स नहीं किया तो आगे चल के आपको टाइप 2 डायबिटीज की प्रॉब्लम हो सकती है, पहली. सेकेंडली, यू कुड ऑल्सो हैव प्रॉब्लम्स विद कंसेप्शन और फर्टिलिटी. तो मेनी टाइम्स हमारे पास बच्चे ऐसे आते हैं 18 साल के, 19 साल के, दे गोइंग टू कॉलेज एंड दे आर सॉर्ट ऑफ they saying हाँ पीसीओडी था, हमने कुछ मेडिसिन लिया, कुछ ठीक हो गया, एंड दे आर स्टिल कंटिन्यूइंग टू डू देयर पिज्जा पास्ता, एंड दे आर कंटिन्यूइंग टू हैव दैट लाइफस्टाइल व्हिच इज ऑल एडिंग फ्यूल टू द फायर. फिर जब वो 25-26 के होते हैं, दे गेट मैरिड एंड दे वांट टू स्टार्ट अ फैमिली, दे आर थिंकिंग कि अभी तो एवरीथिंग शुड बी फाइन, क्या प्रॉब्लम है. दे डोंट रियलाइज कि 18 साल की उम्र से यू बीन डैमेजिंग by not reversing your PCOD. 8 more years of PCOD has continued. So what are the symptoms you will see? Ultrasound में तो मैंने बताया, but ultrasound कोई नहीं कराता. So what is
Yeah.
the symptoms of PCOD? First symptom of PCOD is irregular periods. आपको कभी पीरियड्स जल्दी आ रहे हैं, कभी लेट आ रहे हैं, डिस्पाइट यू बीइंग इन द नॉर्मल रिप्रोडक्टिव एज. सो इफ फ्रॉम द एज यू अटेन मेनार्ड की, लेट्स से 13 साल में किसी बच्ची का हुआ, तो 1 साल तो स्टेबिलाईजेशन में हम देते हैं. तो फर्स्ट ईयर वी डोंट से कि जल्दी आया लेट आया, तो वी डोंट केयर, इट्स ओके, द बॉडी इज एडजस्टिंग. But let's say about 2 years after stabilization, from there onwards, if every month the young lady is not getting her periods, एंड कभी 2 महीने में आता है, कभी जल्दी आ जाता है, कभी 3 महीने में आता है, दिस इज द फर्स्ट साइन दैट यू मे हैव पीसीओडी. ओके. सेकेंड वन, जो पीरियड रिलेटेड एक्ने होती है, उसको अगेन पीपल कंसिडर नॉर्मल, राइट. ये
Yeah.
नॉर्मल वाले में भी थोड़ी प्रॉब्लम होती है. डोंट थिंक द बॉडी इज सो सिली कि कुछ भी आपको बीमारी नॉर्मल तरीके से देगा, ऐसा कुछ नहीं होता है.
Yeah.
एनीथिंग दैट इज हर्टफुल, लाइक फॉर एग्जाम्पल पीसीओडी की जो एक्ने होती है, that is cystic acne, उसे छूने से पेन आएगा. So that is a
Okay.
second sign that that is not a normal acne, कि पेट
Yeah.
गर्म हो गया, मैंने बहुत सारा पानी पूरी खा लिया. It is not that acne.
Yeah.
That kind of acne is different. You also will know from your body itself. But इसमें hard pimples होती हैं जो छूने पे दर्द देता है. So that is important to know that that is a second sign. A third sign that a lady could have PCOD. This is not 100%. मतलब ये सारी बातें सुन के आपने ये नहीं सोचना है आई हैव whatever was told
Yeah.
उसमें से 2 on 3 मेरा है तो पीसीओडी है. नो, पीसीओडी is a technical diagnosis. Please see a doctor to get it done. But the third common sign is excess body or facial hair in a lady. This again is a sign because it shows the male hormones or androgens are higher. अगर androgens higher हैं तो अगेन जब आप अल्ट्रासाउंड करोगे ओवरीज का, तो आपको ये पीसीओडी की अपीयरेंस दिखेगी. क्योंकि वो ऑब्वियसली नेकेड आई को नहीं दिखता है, तो नोबडी सॉर्ट ऑफ कनेक्ट्स वन टू द अदर. बट हैविंग मेल पैटर्न ऑफ हेयर, एक्सेस हेयर ऑन द फेस, excess hair on the body, etc., could mean a greater chance that you have PCOD. So delayed periods, number one, male hormone type symptoms, which is acne or facial hair, and the third criteria is unfortunately an ultrasound criteria only, कि देखने पे अल्ट्रासाउंड पे पॉलीसिस्टिक ओवरीज दिखती है. These are your criteria for PCOD, but उसमें से some of these are clinical symptoms, so women should watch out for these.
So one or two stray hair also could indicate PCOD, or it's just like if a person has excess facial
Yeah,
hair.
you're absolutely right. 1 or 2 hair तो सभी में होता है, because that was meant to be how men and women both lived, na? Before we invented
Yeah.
clothes and so on, when we were still roaming around as hunter-gatherers, we all needed hair to protect ourselves from the environment. ठंड से आपको क्या बचाएगा? It's only your hair. So 1 or 2 hair is
Yeah.
not the issue, but all of us know कि भाई इतनी जल्दी हमें वैक्सिंग करवानी पड़ रही है. Within 15
Yeah.
days I need a wax for sure, or I need threading done, I need some form of hair removal. Then you know कि this is not what all
Not.
my other friends are going through, or people of the same
Yeah.
age are going through. Then you know कि अच्छा ये unusual है.
Yeah. So there are more questions. We have time to take them.
Yes, yes, of course.
Okay, so actually, a lot of people are asking for menopause. So we discussed the symptoms to watch out for, but people want to know that how can they ensure that it is a smooth process. The
Yeah.
menopause. Yeah.
Yeah. So menopause, the important thing about menopause is often, unfortunately, the years just before menopause. So this is one of those things कि अगर आपने सही सेविंग्स नहीं करी, तो
Yeah.
रिटायरमेंट आप कह रहे हो मेरे को स्मूथ रिटायरमेंट चाहिए, लेकिन आप कह रहे हो मैं उससे पहले बचाऊंगी. तो अगर
Yeah.
बचाओगे नहीं तो स्मूथ रिटायरमेंट कहाँ से होगा? सो माय एडवाइस यूजुअली टू ऑल लेडीज हु आर गेटिंग इनटू पेरीमेनोपॉज, मतलब 1-2 पीरियड्स अभी मिस हो रही हैं, थोड़ी मूड स्विंग्स हो रही हैं, तो इस स्टेज में ही आपको इसे ठीक करना है. एंड द वे टू डू इट इज बाय setting aside time for self care. So one of the important things that we ask all ladies to do, those who don't have any problem with this, is to generally get at least one massage a week. सुन के आपको अजीब लगेगा, बट व्हाट हैपेंस इज स्पेशली व्हेन यू गो टू अ जेन्युइन केरला आयुर्वेदा काइंड ऑफ प्लेस, आपके आसपास भी बहुत जगह होता है. आई नो पवाई इज अ bustling sub city, so you guys will also have it over there. कोई भी जेन्युइन केरला वाला जगह जहाँ होता है, जेंट्स डू इट फॉर जेंट्स, लेडीज डू इट फॉर लेडीज, देर इज अ मसाज कॉल्ड अभ्यंगम. अभ्यंगम लिटरली मीन्स रिमूवल ऑफ वेस्ट. आपकी जो, दे डू अ वेरी हल्का मसाज, एंड वो हल्के मसाज से आपकी जो लिम्फेटिक सिस्टम है, जो वेस्ट रिमूवल सिस्टम है, दैट गेट्स स्टिमुलेटेड. इट्स जनरली अ 30-minute प्रोसेस और सो. दे यूज अ मेडिकेटेड ऑयल. बहुत आसान है एंड इट्स नॉट डिफिकल्ट. Those who want to do it at home as well, I'll teach you a trick. आपने कहीं जाना नहीं है, आपने घर पे करना है. One of the techniques to try, depending upon the season, pick an oil that's good for you. जैसे अगर समर है तो you can use coconut oil. अगर
Yeah.
winter है you can use mustard oil. And use that oil 5 minutes before your bath. And what you do is move the oil across your body इन अ ऑपोजिट डायरेक्शन. मतलब अगर आप हाथ का कर रहे हो, यू मस्ट गो फ्रॉम योर फिंगर्स टुवर्ड्स योर थोरैक्स, टुवर्ड्स योर धड़, जिसको हम कहते हैं. लेग्स में कर रहे हो तो कम फ्रॉम योर फीट टू योर एब्डोमेन. सो यूज योर स्ट्रोक्स इन द डायरेक्शन एज इफ यू आर ब्रिंगिंग ऑल द वेस्ट टू द मिडिल एरिया ऑफ योर बॉडी. यहीं से सारा वेस्ट जाता है, तो हेल्प द वेस्ट कम टू द मिडिल एरिया ऑफ योर बॉडी. When you do that, your body begins to eliminate waste better. And one of the main problems of menopause is by the time we reach that age, our waste disposal system isn't as efficient as we were when it is younger. तो इस वजह से छोटी छोटी चीजों से भी आपको प्रॉब्लम होने लगती है. जो earlier you could stay up, like one late night with friends or something, now the same thing is becoming a problem. आपने 3 दिन रिच खाना खा लिया शादी में, चौथे दिन प्रॉब्लम आता ही आता है. So many people don't realize that these issues around menopause, they have a far more severe effect. So ये जो ड्राई ब्रशिंग हम कहते हैं या ऑयल ब्रशिंग कहते हैं, ये आप अगर you make it part of your daily life in the years before you attain full menopause, you will automatically begin to see everything improves for you. A second simple technique that we teach people is called Pada Abhyanga. So again, Abhyanga, the word is common, which means oil se cleanse karna. And Pada Abhyanga means you just do it to your feet. So use again either good quality coconut oil, or you can use a little bit of essential oil like lavender oil in coconut oil. Coconut oil becomes the medium, उसमें 2-3 ड्रॉप आपने lavender oil की essence डाल दी. उस ऑयल से आप सोने के पहले spend 10 minutes just literally lovingly massaging your own feet. The feet is so rich in nerve endings कि उससे आपकी नींद और stress release of the whole day, that improves hugely. अगर वो 10 मिनट आपने दे दिए तो आपको नींद गहरी आएगी. Once your sleep is better, you will find the next morning you're not as crabby. You don't fly off the handle with the kids on small things. The whole family can feel the difference कि पेरी मेनोपॉज के बावजूद इनकी मूड स्विंग्स नहीं हो रही है, ना इनको हॉट फ्लैशेस आ रहे हैं. So try some of these very simple home techniques, and you will feel a much smoother transition to menopause.
I mean, this was really wonderful. Thank you for sharing.
You're welcome.
Some more questions. So, somebody is asking that any precautions to take after one undergoes fissure surgery. Will
Yeah.
it reoccur?
Yes, yes. So, yes, it is very important. Many times surgeons don't tell you कि fissures can reoccur. Fissures are like growths in the anal area which can be extremely painful. So one should look into the root cause of the fissure. अक्सर जिन्हें fissure आता है, उनके शरीर में काफी गर्मी होती है. There is a lot of internal heat. Internal heat की वजह से they often get constipated, and when they try to put pressure to try and move their bowels in the morning, it ends up with these growths occurring. These growths are nothing but veins that begin to grow out because आपने बहुत pressure डाली है. So the simplest thing for you to do for a fissure not recurring in the future is make sure you drink plenty of water. पानी बहुत पीना है, and the general rule that we use is 30 ml per kg of body weight per day. तो अगर आपकी वेट 70 kgs है तो into 30 ml means 2.1 liters of water मिनिमम पर डे आपने पीना है ड्यूरिंग नॉर्मल टेम्परेट वेदर. और समर में उसके लिए आधा लीटर और बढ़ा दीजिए. सो अराउंड 2.5-3 liters ऑफ वाटर पर डे यू मस्ट ड्रिंक. This is for a 70 kg person. Anybody who's lighter, if you're 50, then multiply that by 30 ml, तो 1.5 लीटर पानी हो गया. समर के लिए थोड़ा और जोड़ दो, 1.5 से 2 लीटर के बीच में आपने पानी पीना है. If your bowels are moving well, if your stools are getting formed well, fissures will not recur. Number one. Number two, fiber आपने बढ़ानी है. One of the reasons people get constipated is because they're not getting enough fiber in their diet. Fiber कैसे आएगा? Simple salad से आएगा. If you eat foods, make sure that at every meal you're having some cucumber, you're having some tomato, you're having some roughage, जिसको हम raw कहते हैं. थोड़ा सा भी अगर आप लेना शुरू कर दोगे, तो body will have the fiber needed to form stools which are soft and move easily. You can avoid fissures in the future.
Okay, sure. Um, what is the somebody is asking what is the reason for chin acne, and usually it's happening after the cycle.
Yeah, so chin acne is almost always hormonal, जैसे मैंने पहले भी कहा. And अगर immediately after the period आ रहा है, so then there is a need to balance the hormone estrogen. And उसके लिए again, I would suggest you must work with a specialist, because acne is almost like a headache. इतने कारणों से आ सकता है कि सिर्फ
Yeah,
सैरिडोन ले लोगे तो तब के लिए तो बंद हो जाएगा, बट बाद में आपको प्रॉब्लम आएगी. सो अगेन एक्ने के लिए बाहर से सोफ्रामाइसिन लगा लिया, अंदर से एक एजिथ्रोल ले लिया, एंटीबायोटिक ले लिया, उस टाइम के लिए तो ठीक हो जाएगा. बट इफ
yeah,
यू fix the underlying hormones, so that's what we do as part of the Sepalika PCOD program. So there are specific things that we run for acne. There are specific, so acne वाले लोगों में, again let me give her a home tip rather than try to sort of tell her only about Sepalika program. आप डेयरी को थोड़े दिन के लिए एज एन एक्सपेरिमेंट बंद करके देखें. Even
yeah,
so, the next time, just when your period is starting, so let's assume you have a 3-4 day ka cycle, matlab your bleed is 3-4 days, 3-4 days of the period, and also till about maybe another 4-5 days, so that whole week avoid all forms of dairy. Na doodh, na dahi, na butter, na cheese. Just go off dairy. You may find that it makes a substantial difference. And मैं नहीं कह रहा हूँ कि लाइफ लॉन्ग आपको ये करना है, but this is like a diagnostic. Many times we don't realize that the cows from which we get the milk, they are often pumped with hormones. कोई आपको
yeah,
बताता नहीं. तो काउ को अगर ईस्ट्रोजन दिया आपने जिससे वो दूध बनाती रहेगी, तो दैट सेम ईस्ट्रोजन विल गो इन द मिल्क, इट विल गो इनटू डेयरी, इट विल गो इनटू बटर, इट विल गो इनटू चीज. आप जब
yeah,
लोगे तो आपकी ईस्ट्रोजन पहले से ही है. नाउ देयर इज द एडिशनल ईस्ट्रोजन फ्रॉम द काउ. सो ऑल दैट ईस्ट्रोजन, वेयर विल इट गो? इट हैज टू कम आउट समवेयर. आपका अपना लिवर उसे हैंडल नहीं कर पा रहा, तो फाइनली वो स्किन के थ्रू एक्ने बन के निकल रहा है. ट्राई दिस लिटिल एक्सपेरिमेंट फॉर योरसेल्फ. स्पेंड 7 days. You may just get a clear answer for yourself.
it's such a scary thought also, like we use A2 milk at home, but that is just milk. Like otherwise we have butter, cheese,
Yeah,
and
yeah.
normal dairy, right? I mean, it's such a
We're all,
scary thought.
yeah, we're
How,
all human, right? अब
yeah,
कितना कहाँ कहाँ बचोगे? But all I'm saying is, I don't, therefore, we all have to live life also practically. We can't keep looking over our shoulder all the time. नहीं तो डर के मारे ही life बीत जाएगी. But I'm
yeah,
saying, if you have a specific symptom, then look into it at least. आपको acne
yeah.
है, तो हमने देखा है बहुत acne वालों में जब हम डेयरी बंद करते हैं तो 100% हमें improvement मिलता ही मिलता है. So try that, and you're right. Each of us has to pick our battles. Otherwise, सारा दिन लड़ाई में ही बीत जाएगा.
Yeah, yeah. Okay, so like somebody is asking, there are two people who have questions because they got their hysterectomy done at an early age. So one of them is asking that she has her ovaries intact, so how would she know that she is having menopause? Because yeah, and another one is asking that she also gets acne, so how, I mean, she doesn't has her chums, right? So how does it?
Okay.
Yeah.
So two things, right? So one, let's answer first the lady who's had her uterus removed. So her ovaries are intact, but the uterus has been removed. So once
Yeah,
the uterus is removed, we assume that there is medical menopause. So ऐसा नहीं है. Just because the ovaries may still be producing small amounts of hormones, we don't say that the lady is not menopausal. So menopause, the name itself says menses have paused, right? So
yeah,
that's what menopause means. तो अगर आपके periods नहीं आ रहे हैं because of uterus removal, you must consider yourself menopausal in any case. But what is important is there something that is bothering you? मतलब पीरियड्स नहीं आ रहे हैं तो मेनोपॉज की लेबल लग गई, तो उससे आपको दिक्कत है कि आपको कुछ और क्लिनिकल सिम्टम्स आ रही हैं. आर यू हैविंग ट्रबल विद स्लीप? आर यू हैविंग हॉट फ्लशेस? देन वी कैन लुक इनटू सेइंग, अच्छा ओवरीज में कहीं कोई हार्मोनल इम्बैलेंस तो नहीं है. That's as far
yeah,
as the first person is concerned. For the second person, I'm assuming she also has had her uterus removed and yet she's getting acne, she says, right?
Yeah.
So this is, adult acne is one of those very tough things to treat. So it could have multiple causes, and this is one case where it may not even be hormonal. It is possible for us to have disturbances in the intestine. अगर आपकी माइक्रोबायोम ठीक नहीं है, अगर बैड बैक्टीरिया आपके गट में ज़्यादा है, then also you can get this kind of acne. So again, I'm afraid this is too specific a question. You must see a specialist and they should be able to guide you कि digestive acne है कि hormonal acne है. Then we can take it forward.
Okay. I think skin issues are mostly to do with internal health, right? I mean, people tend to go to a dermatologist, but it's sometimes related to.
Yeah,
Yeah.
not just sometimes. I just wish that, the number of times we refer people to dermats, the dermats would also refer people back to us. वो होता नहीं है
Yeah.
कभी. Generally वो क्या करते हैं, वो आपको एक suppression के लिए एक cream दे देते हैं, खाने के लिए एक antibiotic दे देते हैं. They don't get to the root cause of what is happening. So many times, if you fix the root cause, yes, there is a role for dermats in society. मैं नहीं कह रहा हूँ कि उनके पास मत जाइए. But the
Yeah.
important thing is the dermat is helping you for relief in most cases, unless it's a functional medicine approach doctor. So, functional
Yeah.
medicine doctors go to the root cause, and there are dermatologists who also practice like that. वो आपको सिर्फ symptom suppression का नहीं देते, आपको dietary advice भी देते हैं.
Yeah. Yeah. I think we can take two more questions. So one question is that she's having pain in her foot and ankle every day after getting up in the morning, like only in the morning. So what can she? I mean, what is the thing to
Yeah.
look out for?
So, pains which are limited, especially to the morning, will often be due to something we call a poor cortisol awakening response. थोड़ा सा technical sound करेगा, but let's break it down. सब चीज़ें common sense होती है, ज़्यादा, you shouldn't get worried by medical jargon too much.
Yeah.
So here's what happens. जब हम सो के उठते हैं, the hormone cortisol begins to rise. Why does it rise? Because all night आपने खाना नहीं खाया. We are still evolved from hunter gatherers. तो उससे हमें हंटिंग गैदरिंग के लिए एनर्जी चाहिए, हमें ड्राइव चाहिए, वी नीड द मोटिवेशन. सो आवर cortisol goes up to try and motivate us in the morning as soon as we wake up कि cortisol must rise. We have often found कि जिनमें मॉर्निंग cortisol हार्मोन ठीक से राइज नहीं होता, उनमें ये प्रॉब्लम आती है कि यू गेट एक्स एंड पेन्स फॉर द फर्स्ट हाफ एन आवर 1 आवर ऑफ द डे, एंड देन जैसे जैसे आप मूव करने लगते हो वैसे वैसे वो ठीक होने लगता है. So my suggestion would be, of course, best to see a local homeopath or an Ayurvedic doctor who will get to the root of this. But अगर आपने खुद पे थोड़ी सी experiment करनी है, and I don't mean experimenting by eating medicines, but simple diagnostic blood test, then get a test called AM cortisol done. 8 AM को आके normal blood sample लेते हैं and they test for the hormone cortisol. तो अगर hormone cortisol हमें morning में low मिलती है, that tells us कि that is the reason why the aches and pains are happening in the morning. And again, the simple answer to that, even that would be, अगर अभी तक आपकी periods आती हैं, if you're a lady still in the reproductive cycle, try the seed cycle. Seeds के अंदर
Yeah.
बहुत गुण होते हैं and they can not just balance, like I said, estrogen, progesterone and thyroid, they will also balance your adrenal hormones. Try that, that could work.
Yeah, I'm definitely starting it from today. So we'll take the last question. So she asks that she's having haldi warm water every morning, warm haldi water. So does it reduce inflammation, and what are the other benefits of having it in the morning? Warm
Yeah,
haldi
so
water.
certainly, I mean, haldi in general also reduces inflammation and so on. I don't advise anybody to have haldi water. I'm sorry to have to give you contrary advice. The simple idea is this. अगर आप इंडियन खाना खा रहे हो, you get all the haldi you need.
Okay.
क्योंकि
Yeah.
इसीलिए हमारे एक एक भी ऐसा खाना आप सोच लो कुक फूड जिसमें हल्दी नहीं पड़ता, इंडिया में कुछ नहीं है. एवरीथिंग टेक्स अ पिंच ऑफ हल्दी. तो दिन भर में जब हम पिंच ऑफ हल्दी लेते हैं, स्पेशली विथ फैट्स, रिमेंबर, हल्दी ट्रेवल्स बेस्ट विथ फैट्स, नॉट विथ वाटर. हर चीज
Okay.
में आयुर्वेद में हम कहते हैं देयर इज अ ट्रांसपोर्ट मैकेनिज्म, अनुपान कहते हैं इसको. दवाई दी बट उसको किसके साथ दी. That is why some medicines, you go to
Yeah.
an Ayurvedic doctor, they say घी के साथ ले लो. Some they will say कि आप दूध के साथ ले लो. Some they will
Yeah.
say कि water के साथ ले लो. हल्दी doesn't mix well with water, तभी आप मिलाते रह जाते हो. ऊपर ऊपर
Yeah.
रह जाता है, ग्लास में लग जाता है. हल्दी और पानी का मेल नहीं है, हल्दी और तेल का मेल है. इसीलिए हमारे यहाँ हर बगार जो देते हैं, हर जो यू जस्ट टेम्पर द डिश, जो हमारे इधर पे थोड़ा सा हम तेल को गरम करते हैं, राई का छौंक देते हैं, उसी में हल्दी डाल देते हैं. तो तेल के
Yeah.
साथ हल्दी का मेल है, तो आपको जो हल्दी तेल के साथ मिल रही है, दिन भर आपके खान पान में मिल रही है, दैट इज मोर देन सफिशिएंट. इट हैज सेवरल बेनिफिट्स. एंटी इन्फ्लेमेटरी भी है, स्किन की हेल्थ को इम्प्रूव करता है, ब्रेन की हेल्थ को इम्प्रूव करता है. देर आर लॉट्स, हंड्रेड्स, मतलब सारा दिन बीत जाएगा अगर हम टर्मरिक सिर्फ हल्दी के बारे में बात करें.
Yeah. No, but it was very interesting that you said that we don't need to additionally have it if we are anyway having it with food. That makes sense.
See, there are very specific cases, like if somebody has cancer, we need very aggressive anti-inflammatory
Yeah.
activity. तब भी हम उनको टर्मरिक कैप्सूल फॉर्म में देते हैं, बिकॉज पानी
Okay.
के साथ आप दोगे वो स्टमक में जाके डिलीवरी मैकेनिज्म इतनी पुअर है कि वो रीच ही नहीं हो
Yeah.
पाती. So it is far better to send it with the right way. So even if you want to supplement, I would say it is better to use a capsule supplement which will only open up in the small intestine, rather
Yeah.
than take हल्दी पाउडर इन वाटर. उससे ज्यादा कुछ हासिल नहीं.
Okay, makes sense. Thank you so much, for answering all these questions. They were really helpful and, like I said in the beginning, eye-opening. And I'm sure everyone gained, a lot of knowledge from this session.
So,
So, do you
I'm
have
very,
last words to
yeah,
say?
yeah,
Yeah,
nothing. I'm just very happy to have been part of the session, and we keep telling everybody at Sepalika, हमारे जितने भी patients होते हैं, so we also have, I think, a free giveaway. I'll check with, the people who got us together to manage this session. So there is a simple diet ka tips ka booklet which includes this seed cycling. We'd be happy to share it with everybody who's attended
yeah,
this session. So write in if you have any questions on female hormone health. Thrive at Sepalika is our email ID. So maybe we can put it somewhere in the description
yeah,
or wherever we put it. So if you write in to us, we'll be happy to help you with your queries as well. At Sepalika, our approach is to use dietary supplements, ancient wisdom, simple acupressure techniques to
yeah,
put you back into hormonal health. तो हम पीसीओडी का प्रोग्राम चलाते हैं, हम फर्टिलिटी का प्रोग्राम चलाते हैं. Many, we have had 20 Sepalika babies from people who were told they can't have babies. This is after 8, 9 failed rounds of IVF. So
yeah,
this is the kind of power of nature. जब हम छोटी छोटी चीजें करते
yeah,
हैं, the results are can often be very big, because इतना
yeah,
ज़्यादा world specialized हो गया है. Everybody, reproductive doctor is only working on the reproductive system. अगर
yeah,
बेस ही इतना बुरा है कि हिला हुआ है, तो रिप्रोडक्टिव सिस्टम पे काम करके क्या हासिल होगा? That
yeah,
is the reason many failures happen. So don't ignore things like painful periods, bad moods, etc. These are all early warning signs that there is some hormonal imbalance. There are easy ways like seed cycling to fix it. And if that doesn't give you full relief, then certainly get in touch with a holistic expert. Any homeopath near you, any Ayurvedic doctor near you is good. We are entirely online, so आप कहीं पर भी from anywhere in India,
yeah.
we can treat you. So welcome to come and experience anything that we do at Sepalika, and wish all of you guys vibrant health and well-being.
Yeah, love the session. Very helpful, like I said, and you shared so much knowledge. So thank you so much. And I will give your email address to everyone so that they can write to you, and you can share your diet tips also, which I'll share
Sure,
with them.
sure. And
Yeah,
sorry, I just forgot to mention at www.sepalika.com, we also
yeah,
have literally hundreds of articles of this nature. बहुत ही practical, simple tips you can use. What should I do for
yeah,
painful period? What should I do for delayed period? Acne, etc., etc. So it's just sepalika.com. Go ahead. All the resources are
yeah,
free. All the blogs are free. These are all written many times by qualified doctors, not just kids doing Google search and stuffing for SEO keywords. आपको, you will get genuine knowledge there. So please go ahead, make use of
yeah.
all the free resources, and if you need our help, we're there for you.
Yeah, definitely check out the website, guys. I'm sure it will be helpful for any concerns that you may have.
All right.
Thank you
Have
so
a
much.
wonderful Sunday, everybody. Take care. Bye
You
bye.
too. Yeah, bye. Thank you.